Hey, Nicole. Everybody, that's Carly Garrison. She is a wonderful friend of mine that I've known for years as a medical professional, as a client, as a friend. And Bev and I have started on a journey together with injectable peptides. And I just wanted to chat with those of you that sit in my salon on the daily and we all complain about all of the changes that we're going through, whether you are just embarking on your menopause journey, smack dab in the middle of your journey, or even maybe coming out of that journey. I just wanted to talk to Bev again as a medical professional and just learn a little bit more about that. First of all, explain to me what peptides are.
So I like to think of peptides as your body's text message. Your cells are constantly sending messages back and forth to one another, telling your body when to heal, when to feel full, when to release hormones, also how to respond to exercise, things like that. Peptides are some of those natural messengers that certain peptides are designed to work like those messages and help supporting normal body function. So we're not changing your biology. We are helping to support what is already in place. They're not a magic fix, but definitely combined with the right lifestyle habits and prescribed by a licensed healthcare provider, they can be a very powerful tool for the right person.
I have been using them for about a month. Actually, little backstory. Bev lives in Texas, but she comes back periodically to visit her mom. And she came by to get a little haircut a few weeks ago, and we started talking about it. I personally had wanted to know more about peptides, but it's hard to find info about them. I have a hormone specialist that I work with. It's not a newer thing, but peptides are definitely up and coming and not a ton of people know about them. So we started talking about it. Bev confided in me that she had been using injectable peptides. And so I'm like, oh my gosh, we got to talk about this because it's something I've been really interested in, but I just can't get that much info on it. Before I spoke with Bev, I wanted to try them for about a month. And I will say I am having some really good success with them. And that's why we're here because you all are constantly talking about things that you're having going on with your system, whether it be hair loss or skin changes, or we all have sometimes this weight gain that we used to be able to control and we can't control it anymore. So tell me how peptides work.
It really depends on the specific peptide that you're looking at. Some peptide based medications have been studied in large, well designed human clinical trials and are FDA approved. Probably the most common ones that you hear about are GLPs, glucagon like peptides, or GIPs, the weight management type peptides. So we have strong evidence on how and when they should be used. Also, I feel like people think peptides are a new thing. They've been around forever. Probably one of the most common peptides that you probably didn't even know was a peptide is insulin. So we have used that for decades in diabetic care. So that's a very common peptide as well. We also, as women, will use peptides topically. Even collagen is a good example of that as well. Other peptides are still in earlier stages of research, so the data that we have is more limited, but it's definitely evolving. So it's important not to group all peptides together. They are not all the same. As a clinician, I always encourage people to look at the strength of the research, understand both potential risks and benefits, and have a realistic expectation about what is and isn't proven yet. Some are well established tools in medicine and others are still being studied. But I also think the important piece of do peptides really work is are you doing the other lifestyle things as well? Great example are weight management peptides or metabolic efficient peptides, GLPs, GLP, GIP, your semaglutide, your tirzepatide, Wegovy, all those things that you're hearing about. They really are a powerful tool, but you need to make sure you're also doing the other work, which is making sure you're stimulating your muscles to maintain that protein so you don't get that wasted look, cardiovascularly working out, changing your diet, aiming to really more count grams of protein rather than just calories themselves as a total, because you're trying to maintain that muscle mass as well. Peptides, a lot of times people will say, well, how do they actually work? I like to think of peptides and explain peptides to clients as tiny biologic messengers. They attach to specific receptors on cells and basically signal different actions in the body. These are signals that your body already does. We're just trying to support that and upregulate that. What they do depends on the peptide. Some are involved in appetite regulation, others in hormonal signaling, and others are being studied for things like tissue repair or metabolic function. The important part is that each peptide works through its own specific pathway. So, which is why there isn't one global peptide and they're not always interchangeable. Each one of them has this very specific job that they're trying to support or encourage. It's also why treatment decisions should be based on an individual's needs. What you need may not be what I need, also based on your health status and a medical evaluation. There's no one size fits all approach. People are like, if you had just one, I'd be like, well, what's your pain point? What are you trying to address?
Yeah, I think my list was I was getting really tired of certain skin issues I was having. I am dealing with all of the things like unexplained weight gain. My muscles are not firing and looking quite as wonderful as
Okay, and if y'all have ever seen Nicole, she does have bodybuilding days, and girl looks phenomenal. So she can shred, make the best of them. As we age, this changes, right? Which brings up a good point. I mean, it's why women so frequently are seeking other alternatives and other possibilities of how they can address their needs.
well, and you and I were talking about it yesterday. And one of my biggest conversations with my client when they're in the chair, well, one of them, there's plenty, but one of them, it's like people are mentioning the GLP-1s and things like that. And they're like, yeah, but I'm just going to go off of them and I'll gain the weight back. Well, like you said, it's a opportunity to kickstart something, but you have to maintain your muscle mass. You have to continue to exercise. You have to continue to drink water. We're all sick of eating protein. You have to eat protein.
Yeah.
So there
Yeah.
are things you have to do, and it's a great tool if you're willing to put that time and work in.
And I think that that brings up a really good point. People are always like, well, am I going to be on these forever? And it depends, if you are able to gear down a dose because you kind of learned the lifestyle changes and you've used it properly as an adjunct, a lot of times those clients can work off of their peptides. Some peptides are not meant to be taken every day in and day out, 365. Some of them are meant to be cycled on and then to be cycled off, just so that you're allowing your receptors to kind of reset. You're not burning them out. You're giving them a chance to kind of upregulate and see how you'd go. So that cycling off sometimes is a very important process. I will say that most of those questions are usually focused around the weight management GLPs because people are like, well, I'm going to have to be on it forever. And I think brings up a good point of you don't always have to run and gun out the gate with the highest dose. You can do a lot of what we call microdosing, which is going half or even a quarter of what a standardized dose is used, for example, for weight loss or whatnot. And a lot of times that's where we're seeing the benefits that are outside of just weight loss. So anti-inflammatory, we're seeing better sleep, we're seeing less food noise. You're not getting so obsessed about what am I eating and what am I eating next, and I'm so hungry. And it really helps to just quiet that. But I always tell clients you'll never know what you could achieve with a very low dose without trying and starting there. So definitely a fan of start low and go slow as you progress.
And the good news about the company that you and I are working for, they are medically backed. So I'm so fortunate to have you as a friend who had medical knowledge, but it's great because in order for me to get my injectable peptide, I had to go through an intake process. And for anybody that wants to know, I am on GHKCU. It's a copper peptide. And so explain just a little bit of what copper does for us. And then I've got a few other questions for you.
So copper is really important in collagen production. So as we age, unfortunately, that all downgrades. And so I think I have sat in your chair for 20 years and asked you, Nicole, my hair is falling out. I'm so thin up here. Like, girl, give me a trim that makes this look full and I can tease it up and get big hair closer to Jesus. But I think some of that is just what's a natural thing when we age, our hair follicles, our collagen production, which supports our hair growth, definitely downregulates, right? And so with the copper peptides and GHKCU is an example of that. Cu is the chemical symbol for copper. That's important. That's an important mineral that needs to be present for your collagen production. So, what that peptide is doing is signaling your cells that already help to maintain hair growth and support not having loss. It's signaling to upgrade and do this message so that your hair is continuing to grow and continuing to be fuller and thicker. There are other GHKCU, I will say, is also a good peptide that is topical. So people will notice on their face, especially if you have darker spots or you're really noticing fine lines or even the deeper lines, that the topical and especially the one that's provided by Ellie, it has many properties in it. It has hyaluronic acid. We've used that for years to address wrinkles. We've also used retin A, so there is a retinol in there. There is GHKCU. When you look at it, it'll actually have a little blue or kind of purplish tint to it. All copper products will look that way. So even when you inject it, you're going to be like, whoa, this is bright blue. What's going on? That's normal. It should be that way. If you have a copper peptide, no matter what form it is and it's not blue, I would say I'd probably maybe have it tested and see really what you have because it should be blue. The Ellie product topically also has vitamin C serum, and the nice thing about it is all these products are in one, so you're not having to do multiple tubes, multiple prescriptions. You get it all in one, and it's once a day after you wash your face at night. Nice clean face. You apply it on, and it's great.
Right. Well, and I have to say too, we all scroll through Instagram and see how many fabulous products we should be using, right?
Oh,
So it's very nice, and unfortunately, it always happens late at night, and I'm hitting like, "Sure, I'll buy that, I'll buy that." I would love to know how much money I spend per year on the newest and greatest product. So one thing that I am liking is it's kind of one-stop shopping, and while there might be a little bit of sticker shock in the beginning, I really do feel like I'm getting something that's going straight into my bloodstream and straight into
I do always say to clients, I'm like, if you're going to bargain basement anything, peptides is probably not what you want to do because you really do want to pay for it to be coming out of a pharmacy that's a 503A designated pharmacy as well as an NABP designated pharmacy. That means that they are going to have those products. So there's going to be third party testing that is potency, what is in there is what we're labeling it as. Is this what you're receiving? It also has, they have to follow certain sterile procedures, and so less likelihood of contamination, adverse side effects from that. So you want to make sure what you're getting is quality because you are putting it in your body. You're injecting this, or you're topically putting it on your skin, or you're using it up in your nose and having it be absorbed through the nasal mucosa. You want to make sure what you're getting is safe, and you want to make sure what you're getting is what you purchased, right? So you'll see a lot of different opportunities out there, and a lot of times clients will say, "Well, I can get it so much cheaper," and I'm like, I understand that for sure, but I definitely would check the sourcing because I feel like that's super important, and that's was one of the pillars of my peptide journey. I wanted to make sure that what I was getting was medical grade, which LEMD's products are medical grade, so they will not be labeled as research use only, or sometimes you'll even see on some of those gray or black market peptides, it'll say not for human use, and you're injecting it. So things to be wise. Our peptides also have a lot number. They have a batch number. If there is any sort of issue, there's a way to recall that. The gray market peptides, black market peptides, there is none.
right.
So if there's a problem and they know about it, they actually can't tell you or be able to get it back because they don't label it that way. They don't have to have that quality assurance marker that the pharmacies that we use with LEMD do.
And there are certain countries that we should not be getting peptides from. no matter what. And so tell me about the research from LAMD and where.
So, as far as where we're getting our peptides, all of the active pharmaceutical ingredients, there are not many that are sourced here in the US. So we do get them outside of the US, Germany, Switzerland, China, India. Soon, LAMD will be sourcing them in the US, which I think is important. As of right now, that hasn't quite started, but it's definitely coming. They already have a location here in the US, which I think just makes you feel better. We have a much higher standard and rigor for medications, and I think that makes clients feel safe.
Right. Well, and I believe we are one of the only companies out there that do have the the safest sourcing.
Yeah. Yes.
Tell me what's exciting about peptide research.
Everything is always changing, right? It's expanding across areas. So not only just your weight loss peptides or topical collagen peptides, but it's really expanding into things like metabolic health, endocrinology health, other fields of medicine as far as healing. At the same time, it's important to distinguish between well-established treatments that are supported by strong clinical evidence and therapies that are still being studied. Science is always evolving, and good clinical practice means staying up to date with that emerging research while also being clear about the evidence that is solid and maybe that is not necessarily there, but more studies need to come across so that you can get more information and be informed.
Have you ever noticed that your diet and workouts are same as they used to be? Like I honestly am doing the exact same thing, if not more, and not doing the same thing. So
Yeah, I mean, I feel like especially as we're aging, men and women all the same, our bodies they're kind of slowing down. They're down regulating, is what we like to say out there in the longevity and wellness world. I think the important things about looking at peptides as offering support to some of those pain point areas that people have is that, everybody's aging process is different. Everybody's recovery process is different. Healing process is different. And so, really making sure that you're using a telemedicine or a medically backed platform of where you get your peptides. A lot of times I'm like, listen, ladies, gents, I don't care where you get your peptides as long as you know your peptides are safe, as long as you know that there's less likely to be contamination, as long as you know what's in the vial is in the vial. I think those are the most important things.
so one of the things we had talked yesterday about, I am like fixated and things like this kind of fascinate me. Like you said, I've done some bodybuilding stuff in the past and we have a beautiful menu of different peptides that do a bunch of different things. Some kind of have connecting things that they all do, but I would say I can't remember the exact number, but I think we have 10 or 12 different peptides that can be used, which again is really fascinating to me because I'm so interested in how our bodies work. Perhaps I missed my calling because I don't know. I don't know if I could have made it through biology class in high school, but if I don't ever decide to go back, then maybe I'll study biology.
So I would say bringing up, I think, a huge pain point for us as women, hormonal replacement therapy. And I get a lot of people who ask me, can I take peptides with my hormone replacement? Yes, absolutely. That's the whole point is that you're trying to support that function. They have different mechanisms of action and they are addressing different things. So even men, want to increase their testosterone. Can I take secretagogues, which kind of help to signal the upregulation of growth hormone? Yes, absolutely. That's exactly what you want to do because that also helps to maintain lean muscle mass, keep you strong. Muscles are key, the secret weapon for aging well, right? So you want to make sure that you're trying to maintain that lean body mass as much as possible.
Yep, absolutely. A little bit of background as to why I started doing this because I do hormone therapy. I do take peptides. I was starting to have, like I said, the skin changes. I noticed not only on my face, but I've noticed if I'm leaning over doing push-ups. I'm starting to get that crepey skin on my legs. I was starting to get the crepey skin on my arms. My forehead has started to get really bad. So that was one of the reasons I'm like, I need to try to do something internally. I love that I'm able to inject subcutaneously because I am a freak about things going into your system and then your gut breaking them down. It drives me insane. So talk to me a little bit about that because that's pretty fascinating to me.
So I would say a general, like, global rule of thumb is that most of the peptides, unless you're looking for a specific skin effect topically at a certain area, or you're trying to address a gut issue, injecting them is probably where it's at, just because your gastric juices, those acids in your stomach, are not going to break them down. Now, there's always exceptions to the rule, right? So I talked about one of them already. So topically using GHKC, in a topical preparation can have positive effects at the skin and help to support that collagen, help to support less wrinkle formation, things like that. If you're looking to gut inflammation, GI things, BPC, body protection compound 157 is commonly taken orally. If you're using BPC for more of a recovery muscle tendon issue, that is better injected. So it definitely depends. It's very personalized. So it definitely depends on where is your problem? What is the source of your problem? We do have some nasal peptides that work wonderful. So inside our nose, it's really vascular. This is a commonplace in traditional medicine to deliver medications. And we do have some wonderful brain support products, Link, CMAX, that really can help with supporting less anxiety, mental clarity, things like that. You're putting the product where closer to where the issue is, right? Your brain is here inside that vascular network inside of your nose. Those medications, when they're absorbed there, can cross the blood brain barrier and then get closer to the source of your issue.
Great. My initial intake probably took about 2 weeks, which is good because I had medical professionals that were making sure that I was safe, that I was taking something that was okay for me based on the other medications that I was on, the hormone therapy that I was on. If you ever have any questions, anybody has any questions about LEMD or what I'm doing, what Bev might be doing, I think my journey right now is pretty similar with there might be some variations, but
Yes, of course, every day I'm like, oh, I think I want to add that. I think I want to add this.
yeah.
Which brings me to a good point. I do believe it is good to start with one peptide at a time. You know, get on it, slowly increase your dosage, and you're monitoring to see if there are any adverse side effects and what benefits you're having. You can always contact Nicole or I, and we can give you some good ways to monitor your symptoms and things that you should really be thinking about mentally as keeping notes of how you're progressing along in your path.
So, well, thanks for talking to me today, Bev. I appreciate it.
You are welcome.
We'll chat
Sounds good.